Good evening, everybody. It's been a minute. Man.
Good evening, everybody.
Uh-oh. My
It's been a
stream is on
minute.
somewhere.
Good evening,
We need to mute it. We
Uh-oh.
need to mute it. There it is. Anyway. How's it going? I am Milkman L. Thank you for joining me tonight. Hopefully you guys had an awesome weekend. My weekend continues because I am on vacation this coming week. It's been a hell of a week, though. Tell you what. Man, between, well, several things have going on, but yeah, you may, if you are a regular here, you may have noticed there was an unplanned stream skip on Wednesday, because I absolutely got crushed on call on Tuesday. I had literally the worst call that I've ever had since being a professional. And yeah, that was terrible. Tonight we're going to be talking about grief and coping in medicine, as the title hopefully describes adequately. Unfortunately, that is inspired by recent events wherein one of my colleagues was tragically killed in an ATV accident. So we're all sort of trying to figure out how to cope with that. So I won't go too much into detail about his personal situation, you know, out of respect for his family, but that's kind of what we're dealing with here. But you know, also there was in said difficult call, there were a couple people with really bad outcomes of various kinds, and you know, we have discussed grief on this stream multiple times before, but it bears revisiting because you know, everybody has kind of started school, and you know, we're getting back into the swing of things where new people are going to be exposed to like death and destruction all the time. And I say that sort of tongue in cheek, but that's really what's up. So that sucks. But there are bright points. There are bright points. So first off, and certainly least importantly, this character is turning out to be super enjoyable. This is a Frostblink Ignite Elementalist that I've sort of leveling geared up a little bit. I literally have plain gloves. I should at least like throw an essence on these or something. Maybe I'll, yeah, whatever. Screw it. I don't even care. I don't even care enough to do that. But yeah, this character is cruising, dude. It is buttery smooth and very enjoyable to play. I'm glad I, oh, what am I doing? I need to go kill Katava. That's the plan. I think I've done everything, right? Yeah, cool. Oh, you know what? I'm not sure. Yeah, I never, like, gone back and cleaned my quests up. Let's do that. Lightning Conduit? No! Hey, Fizzy, what's up, dude? If you're listening to the stream, no, it is not Lightning Conduit. It is Frostblink Ignite Elementalist. Fizzy is... he runs... Alexander, I'm quite well, Cockroach Princess. How are you? But he has a podcast, and actually I appeared on it a while back after doing a Reddit AMA. And we've just kind of stuck together and kept in touch. See, what's he doing? Never in a party. Oh my god, level 91. Your daughter's birthday on Tuesday? Wonderful. What are you doing? What are you doing for said birthday, my friend? Hopefully you guys are doing it large, doing something big and fancy. Ah! Uh-oh. What are we doing? Ah! There's a joke because Exalt used to be like the big money currency for Path of Exile, then they changed everything around, And how am I holding up? I'm doing good, man. I'm all right. We're just a little sad trying to figure it out. But yeah, exalts are like not worth shit now because they're not very useful. Why free currency? Sometimes people give away their stuff when they're quitting the league. Hey, Sunday Funday, what's up, dude? Oh, no problem, man. No problem with the secondaries. Hopefully, you got some use out of that. Got some decent advice that you could use. I don't know. All of that was... You have to keep in mind that my position... Oh, he thinks I'm somebody trading with him. Oh, no wonder. He thought I was some random dude trying to trade him. That's hilarious. I love it. I was very confused. Me neither, yet here I am. But yeah, anyway, my approach my approach to interviewing people and evaluating applications and stuff is very straightforward and realistic, I think. Like, very pragmatic. So like all of the, you know, I kind of see through all the bullshit basically. And some interviewers don't, honestly. Why is his name Fizzy? His, like, Fizzy is his handle. And he's doing a build that's popularized by a streamer named Kobe something. I used to interview people. Yeah, well, I interviewed people for med school. But now I interview people for my group. So, like, the big time. Yeah, but, like, interviews for jobs are very different, at least in my group. And, like, the last two people that we hired, we didn't interview. What kind of interview questions do I ask? Oh, I mean, I mostly just try to be conversational, you know? Just talk to people and get to know them. Like, I have their application, right? So, you know, I don't, unless there's like something super interesting in their application that I want to know about, I just kind of like talk to them. And that applies to med school as well. Can I ask you an interview question right now? Tell me about yourself. Haha! I'm a dick. I hate that question. Yeah, it's a terrible question, honestly, but you have to expect to get asked it, right? And, like, honestly, if you can't tell somebody about yourself, like, what the fuck are you doing? Like, just talk about something. It doesn't even matter. Talk about random shit. Like, everybody overthinks it and, like, you know, tries to spin themselves into some, like, medicine master. Like, everything that I do revolves around medicine, and all of these things that I love make me a great candidate for a doctor. Like, yeah, okay. Also makes you sound like you're one-dimensional and don't have anything else going on in your life, in my opinion. Hey, Uranus, what's up, man? What do you even say? There's too much to say. Yeah, I think, like, I pretty much just, you know, I talk about the things that are most important to me. Like, you know, hey, I'm in no particular order. Like, I'm an anesthesiologist, I'm a dad, these are the things I do. Here's my hobbies. You know, like the things that I enjoy and make me kind of who I am. But, you know, don't talk about your fucking research. Like, even if that is who makes you who you are. Don't do that. That's bad. Just leaving the library. Been there for 12 hours because exam. Yikes. Good old exam time. I live in at least 2 dimensions? Oh, you live in at least 4 dimensions, my friend. Maybe as many as 12. Yeah, having exams on Monday is kind of a bummer. I've strongly preferred the Friday exams because you just get to purge. Yeah, Friday exams are money. That's where it's at. Because you get to go out and have fun, and there's like no strings attached to your weekend at all. That's when all the serious, crazy nonsense happens in med school, in my experience. You have an exam on Saturday and Sunday? Why? What kind of terrible trash is that? Oh, I got a level. Cool. Yeah. We'll get there. Purge, absolutely purge. And you have your OSCE on Friday. Great.
When I'm ready and not before.
Yeah. Second the Friday exams. Like, I mean, all day long, dude. Oh, wow. I'm not paying attention to what I'm doing at all. Great. Okay. Yep. Frostblink. Oh, what's OSCE? Oh, son, you will find out. You will find out what an OSCE is. Oh my goodness. Oh shit, look at this diagram that Francis made here. As soon as I am no longer fighting a boss, I will bring that up, because that is some ridiculous shit. How do you learn anything from that? Just call it something else. Oh, okay. I thought OSCE was a pretty general term. Maybe not. Ouch. Alright, Katava's heart. Eat a fat dick.
I need more mana.
Oh my god. My kid is killing me. Hold on. Hey Owen, go get mom. She's in there. What are you doing? It stings real bad? Why does it sting real bad? Did you itch it? Okay. Well, go talk to mom. She's in the other room, please. Thank you. You like those? My kid is admiring the art that I got for my game room. He needs more mana. He does need more mana. Hey, Owen, leave those alone, man. Go get mom. I'll be back. Oh my goodness. Did he pause an online gamer? Oh dude, kids are the ultimate final boss. Let me tell you. There is no stopping them. Hey man, what's up? Oh god. I'm stopping to read chat. This is a shit show. Oh man. I just like eat a slam from the last boss. Or former last boss, I guess. Love how I'm so chill with my kid. Oh yeah, well why would I be like, dude, if you escalate, they escalate. There's no reason to be upset. Because you just fuck yourself in the long run. Actually, in the short run. It gets real quickly. Yeah, I think my philosophy is, you know, most things in life are not really worth getting super worked up about. Kind of have to be that way to deal with crises for a profession, though. Fuck yourself for the long run when you're in the nursing home. Yes. This is something that is true. That is true. And they remember all the times Daddy yelled at them for coming out of their room early. Should I order this? I don't know. Hang on. Let me get smitten by this giant demon, and then I will look at it.
The flame of hope may flicker, but it
Oh, he fucked me up. But that's actually supposed to happen. All right, what do we got here? Crispy chicken sandwich, 100%. You should order that. That sounds delicious. Where's it from? Okay, here's this chart that I was talking about. What the fuck even is this? How do you learn anything from that? This is like a dermatome map, I guess? That's actually not, that's not too bad. This is insanity, though. I don't know what the hell you're planning on getting from this. Why don't I become friends with the demons rather than fighting? Because it's so much less fun than setting them on fire and watching them slowly die. It doesn't include dermatomes? Oh, this is all innervation. Oh man. Yep, I don't miss that. I don't miss that at all. It is definitely not fun to look at. No, it isn't. No, it is not. Alright, Sin, what's up, man? I sound like a great guy. Oh, just wait. Just get to know me. You'll change your opinion.
I'm Captain Lily Ron. Remember?
This ain't no charity run. Can I teach you how to talk to kids? I paid somebody a whole lot of money to do exactly that over the past like 3 months. So no. No, I cannot. Yeah, just wait till you shadow me. Yeah, we've actually had a stream viewer come and shadow me, believe it or not, and he did not kill me. He did not shank me in my sleep. Or kidnap me or anything like that. It was actually very smooth. He was a nice guy. Believe it or not. Okay, I meant to go here. Can I fly to North Carolina? Let you shadow me? No!
quite a step.
Give me my skill point.
I thought you were farewell.
Damn me. Stay sharp out there.
Do I play chess at all? I know how. I haven't played chess for... I don't even know how long. I mean, like 20 plus years, maybe? I used to play it all the time, actually. I'd play against my dad, like, daily. What's my chess rating? Terrible, that's what it is. I have no idea. I don't even know what a chess rating is, so if that tells you anything, that's probably not good. I have never done SSF before. No, too lazy to farm gear. Oh, caps lock. Ah, get out of there. Please play a chess game on stream. Oh no, man, that's, well, actually, I don't know, that's not too bad. Litchess.org, okay. Community friend, I don't know what a GSSF is. Nah, whatever. Up to me, they're both good. Okay, let's play chess. Let's do this. It's just chess.com. See what we can do. Play with someone at my level. We'll just say beginner. Play as a guest. Alright, do I go first? Guess so. Chess is big nowadays? Yeah, there's the those girls that play chess, right? Like the hot 20-year-olds or whatever that they go and like frickin' hustle people. Botez, yeah. You can teach me chess if I want. No, I'm good. I don't really have many opportunities to play chess. Yeah, I am not good. Can I please teach you how to play? I cannot teach anybody how to play chess. It's a terrible plan. Oh my god. Are you gonna take your turn or what? Okay. Killing me, dude. If I ever don't feel like dealing with my kid, just divert him to mom. I try to, but that doesn't work very well. As you just witnessed, it does not work well. Everybody needs a break though, right? Oh, it's my turn. Oh shit, I'm not paying attention. Sorry, bro. Playing a 10-minute game? You mean like each person has 10 minutes? Oh, I thought it was like... Oh god. He has 10 minutes to make a move? Fuck, that's not good. Okay. Well, I lose something important now, don't I? How do I counter that? Have to be written and practical in the same? Play knight to a4? Is that a good idea? Why would I do that? Oh, here? Yeah, that's actually a good idea. Same for me, though. Okay. Well, at least this misery will only last 10 minutes. Did my lab group have to check my cadaver every day? No, I don't think so. I do not recall that. Let's see. Might last 20, 10 for both of us? Yeah, maybe so. Maybe so. Well, dude, sometimes you can't, like... You can't cut those frickin' bodies open, man. They're just so leathery, right? So very leathery. What are we gonna do here? Oh, bitch. Yeah, that's fine. They make you come in to check the cadaver to spray it down? That sucks. Do not know. King of yeah, totally. Look at me rocking it. Look at me rock this game. Oh, man. Speaking of rocking games, huh? How about the Chiefs? How about them Chiefs? That was a brutal ass-kicking of the Arizona Cardinals, in case you missed it. That was glorious. Fuck Arkansas. Agree. Agree with that. Dude, if I win this game, it'll be a damn miracle. Get my knights in the middle of the board, they're dead on the edges? Fair enough. Awake one, did it? Did they now? Well, I will take your advice, sir. Hey, Gucci, what's going on, dude? How are you? How is life? App kicked Texas A&M's ass? Oh, that's amazing. Good for them. Where are we going here? Just watched a lot of football. That's not a bad thing to do, man. Not a bad thing to do. Do I want to make that trade? Trading knights, huh? Yeah, sure. Attack the C6 pawn? Oh my god! This is so complicated. Not playing too bad considering I haven't played in 20 years. Am I winning the Special Olympics right now? I sure hope so. Yeah, I literally have not played for a long time. Oh shit, that was retarded. Why did I do that? Terrible. Now what do I do? I can't believe I'm very surprised he didn't take my rook there. How do I back out of that? Maybe I'll just go. I'll do that. Hey, Nautilus, what's up, dude? Moving king up one space? You're like right here? That seems like maybe a bad plan. Knight to d3, c5, and fork the rooks. I don't even know what forking the rooks means. I have no idea. I am out of my league on that one, brother. Yeah, it has been a while, man. I'm happy to see you. Do that. Interesting. Most schools include content from previous blocks in their exams. Not usually explicitly, but like sometimes, your physiology shows up over and over. Because it's not, you can't just like not have physiology all of a sudden. But yeah, I mean, there's like, for me, it was minimally cumulative. You have discrete questions over previous blocks. That kind of sucks. I mean, hopefully they're at least like sort of globally relevant, you know? Like, that's interesting. Hmm. The back rank made on H8 can instantly win you the game. Yeah, I'm trying to keep this alley open for that. Believe it or not, I actually had that in mind. I feel so smart right now. Thank you. I feel so smart. Okay, that is an interesting move. Maybe he just doesn't want me to do that. Deep back and lower extremities. Okay. Okay. So let's see. Where do we go from there? Get my knight out of danger. Karyotype interpretation? Like, oh, okay. So like trisomies and stuff like that? That shouldn't be too bad. Rip the back rank, exactly. Bummer. Yeah, I don't miss all that stuff at all. Okay. I'm gonna run out of time, fuck! What do I want to do? Look at pink and purple's pictures of cells. Yeah, pathology is terrible, man. Like, if you're not interested in pathology, it's just like, it's awful. There's no reason for you to be doing that. Okay. Okay. Let's see. Now what do I do? What did you say? King to D3? The knight to A3. Yeah, I don't want that to happen. So I guess we'll do that. Histo exam and haven't looked at the lectures. Dude, yeah, histology, man. I just not a fan. Not keen. Dude, I don't know what I'm doing. Have you not figured that out yet? I have no idea what's going on. Oh, here we go. Special concoctions for IV therapy when it comes to curing hangovers. Oh yeah, absolutely, dude. I have mentioned this before, but well, so I guess I technically still own an IV therapy business, but banana bag. But yeah, we used oh, I won. What? Just don't run out of time. I didn't run out of time because I fucking won. That's right. I'm the best chess player in the frickin' world. I did it. I'm so proud of myself. Oh, that was ridiculous. I don't know how I won that game, but whatever. How did I don't know how I won. I have no idea. I demolished him. Yeah, I totally demolished him, didn't I? Just ran away with it. Let's see. Did I clean all this up? Yeah, okay. So Act 6 it is. How did I win? I don't know. But yeah, for yeah, back to the topic. Like IVs for hangovers are fucking amazing. So hangovers are generally sort of a like multifactorial thing. Like it comes from dehydration, hypoglycemia, sort of like systemic inflammation as well. So basically you just have to do things that stop those. Unfortunately, it just so happens that all of the things that treat those things, like NSAIDs, steroids, and you know, just like typical nausea medicines and stuff, so you can treat the cause and the symptoms really easily with very common, very safe medications. Like specifically we use Toradol, which is ketorolac. It's like a turbo ibuprofen basically. Zofran, which is on Dancitron, really common nausea med. And what else did we use? Decadron, or dexamethasone, which is a steroid that's like super good for inflammation and nausea. And those are all super cheap. Like our cost for an IV was like under $30, probably more like $25. And it works amazingly. And everybody feels like, give it half an hour and they just like do a total 180. And they're like, this is the best thing I've ever done. Ketolar and ketorolac are the same. Yeah, totally the same thing. I act like I haven't played in a few months. I haven't played in a few decades, bro. But I'll take the compliment. You just drink water? I mean, water works. You could do a lot worse than drinking water. Most people don't do that, but yeah, if you get an IV, man, your day is back. Like, I had a group of friends who I play Warhammer with, or have played Warhammer with in the past. I haven't for a while, but they were like laughing at me for charging so much. And by so much, I mean $90, which is actually like half of what most places in town charge for an inferior product, because they don't use meds. But so we charged $90 for a hangover cure, and I was like, dude, what's your day worth to you? Like, is your day not worth $90? You'd rather feel like shit all day long to save $90? Like, I sure as hell wouldn't. Like, when you can fix it immediately. Am I lactose intolerant? No. Where do you get these IVs? I got them, man. I'll sling them. And I bet you, in most major cities, they have... Jesus Christ, where are the last freaking monsters? Oh, I killed him. Talk to Lily for your reward. Got it. Totally missed it. Most major cities have, like, IV clinics popping up, but you gotta watch out for them, though, because a lot of them suck. Oh, my goodness. Rated the channel with 4 viewers. Deathbeam, what's going on, dude? Thank you for the raid. Appreciate it. Welcome, folks. Welcome, welcome.
Farewell.
How many IV casts that accidentally followed you home from work? Yeah. Whoops, it's in my pocket. Oh, my gosh. How did that get there? Oh, this bag of IV fluid's in my pocket, too. That's weird. Oh, and all the IV supplies that I need are here also. That's so strange. How did all of this manage to just follow me home? It's going good, dude. Thank you. This is the first time I've been rated in a long time. I'm pretty sure nobody knows I exist. Well, welcome everybody to my little stream. We're doing weird shit. That's kind of what we do. Playing Path of Exile, and we actually haven't gotten to the topic of the day yet, which is grief and medicine, which is inspired by me dealing with a couple people like heinously losing their lives on Tuesday night, and one of my colleagues actually dying in an ATV rollover accident yesterday, which is terrible. Can I start an IV on yourself? I physically can. Our little stream. Yes, our little stream. I must speak. I one time had a string of, I think it was 4 days where I was on call every other day in residency, and calls in residency are just brutal ass kickings. Like, we were busy the entire time, maybe get like half an hour of sleep at a time. So like 2 total hours of sleep, 2 to 3 per night. And I did that, you know, every other day for a week and a half. And I came home and I ate 10-day-old lamb because I didn't know what day it was. And my wife was out of town. And I gave myself like heinous food poisoning. And so I'm just like profusely vomiting everywhere. And I tried to start an IV on myself. I had everything set up. I had all of the like drugs drawn, I had the IV line primed and everything. I was ready to go. I just could not stick myself. And I don't know if you'll be able to see this on camera, but I have a gigantic vein in my hand that would be super easy to stick. It's right there. I mean, you could put a 14 gauge in it, no problem. But I couldn't do it. Just could not make myself do it. Hey, Synapse, thanks, man. Thank you for the sub. I appreciate that. I thought you were already subbed, though. But I always appreciate more support. Just like a good jockstrap. Thanks, man. What if you have a really veiny cock? Well, then, you know, there's your access, bro. There's your access. So there's... Should've just called me, you got me? Oh, shit. Well, next time I'll know. Yeah, you can do intracavernosal, you totally can. Dude, you can do some seriously weird shit when, like, life is on the line. Like, penis IVs. Do you guys know what a fistula is? Like a dialysis fistula? Let's have a look. In case you don't. So basically, they, attach an artery and a vein. Yeah, it's a worm in your arm, exactly. So they attach an artery and a vein, and after a while they look like this, because veins are low-pressure systems and arteries are not. So the vein, like, dilates hardcore because it can't handle the pressure. And so they look like this. And this is all blood flow. There's blood going through this. To be deemed patent and functional, a arteriovenous fistula has to flow 1 liter of blood per minute. And for reference, your heart pumps about 5 liters of blood per minute. So that's a lot. That's a whole lot. So you can stick that if you want to. Hey, Nan, what's up, man? Thanks for following. I appreciate it. Hope you're enjoying the talk. But yeah, yeah, you can stick that. I've had to do that one time, and it's crazy. That shit explodes blood everywhere. Like, we just could not get and people with, like, renal failure, you do that for people with kidney failure, the fistula. And they just have terrible veins, partially because they're massively unhealthy people and usually, like, vasculopaths to begin with, and have, like, smoked all their lives and have diabetes that's uncontrolled and blah, blah, blah. But also because their veins have been traumatized so much because they've just been stuck with every frickin' needle under the sun. And so they're all, like, sclerosed and hard and tiny. It's like if you get a rosebud, is that reversible? A rosebud. Yeah, I mean, it is actually reversible, but, like, it won't, it'll take a long ass time to go away. Because it's already like dilated, right? So the stuff, like things that stretch usually don't go back to their original form very well when you're talking about the human body, so. 20 gauge diffusix? What's a diffusix? Is that just like a Plerex catheter or something? Like something you just stick in there to let it sort of ooze air out? Or fluid, whatever.
I need more mana.
Special IV catheter you can pressure infuse at smaller gauges? Oh, okay. I didn't know you actually needed a different kind of catheter to pressure infuse. I do that on regular IVs all the time. In fact, that's, I've heard of vaginal fistulas. Maybe you're thinking about something else. So, I have an interesting story about that, believe it or not. I think I've probably told this before because it's hilarious. But, so when I was a med student on my surgery rotation, like, we always had to go to the surgery morbidity and mortality, aka M&M meetings, where basically some poor resident goes up and presents this case and gets their asshole torn open by all of the attendings and stuff, just gets asked all these questions and made to look a fool. Because that's what we do in medical education. We belittle and berate people and grind them to dust for education or something. Anyway, one of the surgeons made this huge mistake, and we'll get to what exactly it was. And so the resident's up there like talking about what's going on, and he shows a slide of, you know, this lady's having all these complications and like, you know, et cetera, et cetera. And he shows a CT scan of like this lady post-op, and he was like, and this is her descending colon that is anastomosed with her vagina. So the surgeon had attached her colon to her vagina and not her rectum. So that's kind of a problem, as you might imagine. So he got to answer all of these questions about why his attending screwed up and put somebody's colon and made on their vagina and made them poop out their vag. And he's like, I don't know why they did that. I'm not sure. You like, the whole thing is like, you know, you get put on the spot like it's your problem and it's something you did wrong, and everybody behaves as such. Is that bad? No, it's fine. It's totally normal. Common surgical procedure. That's embarrassing for the attending? Yes, it is. Yes, it certainly is. Yeah, get out of here. Stupid Tukohama's protection. Sounds like an academic surgeon. Oh, yes, it was. The best one. Can't remember if I saw the pleural fusion x-ray. Yeah, I did, I think. Yeah, you posted that up. You shouldn't be kidding. That happens in academia a lot. But to be fair, honestly, that usually happens because I bet you the patient's anatomy was just absolutely foobar. Like, they probably had some sort of like terrible, you know, metastasis, like pelvic cancer or something that made it like really hard to tell like what the hell was going on. Because those academic center patients are just so sick. Dr. DNP, nice. There's 3 holes, there can be. You're learning so much. You are learning so much, my young one. Not all of them are for fun. That's a key their car plate? Yes. Piss in the vents. Sugar in the gas tank. All of the above. Oh no, Gen Med service, oh god. 70-hour weeks, bummer. That is the suck. I don't miss my internal medicine rotations at all. They could all be used for fun? I guess for some people, sure. Why not? Why the hell not? 8-week IM? Yeah, I had 8 weeks of medicine too. And I had... I think I just had 4 weeks of family practice. Yeah, I actually didn't mind family practice as much as I thought I would. Just as like a learning experience, but dude, I would frickin' cap myself in the face if I had to do that professionally. Medicine in clinics is not for me. I do not vibe with that at all. I just constantly fire my patients. Be like, oh, you didn't do what I told you to do? Okay, cool. Well, don't come back until you decide to. Nice to see ya. Like, I can't help you until you take your meds or get your scans or whatever. Go away. Anything can be used for fun if you believe hard enough. Totally. Oh my goodness. That is hilarious. And also probably true.
When I'm ready and not
There are some very creative people in this world. Alright, shall we talk about grief and coping and the terrible crap that happens in medicine that you have to deal with somehow? I think we should. So, as I mentioned in the intro, and just a second ago, in fact, I have had a very busy last week. So my call on Tuesday was, as I mentioned, the worst one that I've had since leaving residency. Like, easily the worst one. I was up continuously, like, working hard with really sick patients all day long. And what's terrible is it looked like it was a huge cock tease, because it looked like the operating room was going to be done at like 5 o'clock, and I was just going to cruise. There was nobody in OB, no inductions, nothing to do, like, scheduled. And then I just got, like, bitch slapped into oblivion. Unlucky, big time unlucky. What's going on, Denny? How are you, man? So, yeah, one of the fun things that I got to do was deal with a double shooting that rolled in. Both patients were hit multiple times, I think like 6+ times. And so I got to emergently coordinate 2 operating rooms to bring them back, emergently to the operating room and fix them up however we could. That said, despite those efforts, one of the patients did not make it out of the ER. The other one did, though, and he had a lot of damage. And for, HIPAA reasons, I won't go into exactly what, but we'll just say that we fixed a lot, and he still had a long way to go, and was brought back to the operating room multiple times during the last week. You have palliative next week, so it's a good topic. Yeah, dude, oh, man. So quick props to all my palliative medicine friends out there. If anybody is watching this who's interested in palliative care, you guys are like sleeper best service in the hospital. No lie. That is such a useful thing for patients, and it's such a nice thing to not have to deal with that, and to be able to call on people who are good at having those tough conversations to, like, set goals of care and manage expectations and things like that. Palliative care is the shit. You guys are awesome. So thank you for your service, because it's something that I have zero interest in doing. Like, negative interest. Is it IM Fellowship? Yes, it is. Yeah, you do a lot of good. Lots of good. It could be family, too? I didn't know that. It makes sense, though. Makes sense. I mean, I don't doubt it. Makes perfect sense. I would think anything, basically, that, is, like, clinically involved would lead to that, right? Like, most of medicine, like primary care, leads you, you have those discussions with people just kind of, like, as a matter of course, but... Yeah, people don't go in thinking about money because it reimburses like shit. That's why it's terribly reimbursed. Which is a shame, because like I said, it's a super valuable service. What is pay? Yeah, pay, like I said, pay is terrible. I mean, terrible's a relative thing, but I think you actually like take a pay hit, like if you have an internal medicine residency and you can be a hospitalist, it's actually like a downgrade in pay. Okay, I walked right by the exit. That was brilliant. But yeah, so that happened, and then also again, we lost one of my colleagues to an ATV accident yesterday. So it's not just patients that have bad outcomes. So, like, how do you deal with that, right? Like, you see, people suffer and, like, do badly all the time, and it just sucks, There's really just no way around that. It's terrible, but you have to find a way to soldier through, and, like, especially in my line of work, you can't, like, give up, right? Just because I'm, watching 4 operating rooms at a time, so if you just like phone it in, there's 3 people who suffer for that. So, you kind of have to just like gut it until,
Need more mana.
you know, there's an appropriate time to like grieve and handle those emotions and those feelings and stuff. But that's hard, right? Sometimes that's really difficult. And even if these things aren't particularly like emotionally taxing for you, like on an individual level, I can tell you, like from residency, you know, you see all these people die constantly because, again, academic medicine has like the sickest of the sick patients, and you know, people croak on the floor constantly. Like, we had to go to all the codes, which thank God I don't do anymore. Like, anesthesia doesn't go to codes at my hospital unless you're like specifically called, which is great. That is amazing. But yeah, like everybody who dies in the hospital, basically, you see it. You know, and even if you're like, you know, that guy was 90 years old, had like 7 types of cancers, and like gonosyphilis and all, you know, you name it, like moribund dude, where death is not the worst outcome by any stretch of the imagination. Like, you're still there for it. You know, you still see this stuff, and it kind of adds up. They croak on the floor. Well, the floor is the colloquial name for like the hospital. I mean, some of them, I guess, are literally on the floor. but yeah, I'm what I mean is, yeah, like in a hospital room. Already desensitized. Well, yeah, I mean, but you're like ultra front lines, right? Like, you see, you and as a so Aranis was were you paramedic or an EMT? Can't remember. But in any event, like, you know, he sees the people with their brains blown out on the sidewalk, right? That's the, like, that'll get you. That's probably worse, in my opinion. EMT, okay, paramedic, no. Got it. Did CPR on a 1-year-old? Yeah, that's terrible. That's one reason that I don't really want to do peds in anesthesia, is you just see, like, terrible shit happen to little kids all the time. And, like, you make a lot of difference. You know, you do a lot of good in your career, but you also, like, see the worst humanity has to offer. You know, you see, like, victims of abuse and all that sort of stuff, and it's just heart-wrenching. And, like, I suppose I could deal with that if I wanted to. Like, I made it through my couple months of peds without too much problem, but I would rather not choose to do that as a career. So part of coping is setting yourself up for success, right? So, you know, if you don't think you want to see kids suffer all the time, like, maybe a career in pediatrics is not for you, because that's what you're gonna see. Maybe not so much with, like, straight up outpatient peds, but if you're a hospitalist, you see that constantly, right? Like, they're not in the hospital because they're doing well. And kids are resilient little bastards too. Like, you know, it takes a lot to put a kid in the hospital. Okay, I guess I'll go through here. When will you see stuff like that? Whenever you start clinicals. The shit your dad sees as firefighter EMT is crazy. Yeah, one of my friends is a battalion chief in the KC Fire Department. And he's like, yeah, we see some fucked up stuff. Unwitnessed traumatic etiology? Yeah, right. Yeah, where you just, like, see people, like, splattered. And I mean, like, honestly, it sounds like, from my friends' accounts at least, it sounds like some of the stuff is just, like, so graphic and overwhelming that it's, like, it doesn't really hit home. You know, it just looks like a joke, or, like, it's almost fake or something. I don't know if I'm describing that right. It just, like, seems unreal, so you're like, okay, well, that was horrifying, but we're moving on. But yeah, if you're, like, involved in the resuscitation of a patient, that's why you have such twisted senses of humor. Yeah, for sure. And I mean, like, I am super hardened to all this stuff, you know, like, you've got to, like, apply some rationality to it at some point. Where, like, yeah, you know what, that person was gonna die, but, you know, you do have occasional unexpected losses, and that's not fun. Yeah. How do you cope with the grief? Well, that's what we're gonna talk about, isn't it? So the first thing is to just talk about it, like, be open about, you know, your feelings and what's bothering you and all that sort of stuff. And the nice thing is that, especially in the operating room, everybody is accustomed to that. So I sort of am, have a built-in support structure. Like, everybody who works in the operating room has seen people you know, die in spectacular fashion multiple times. That is like, it's just kind of comes with the game, right? That's part of the game. Just match with your first year preceptor. You're nervous because it's a pediatric hospitalist? Well, you shouldn't be nervous. They're probably super nice, right? Generally, people who go into peds are like the lovey-dovey, like extra patient caring types. I think that's a good thing. That'll be a good person to like learn with. But yeah, so you talk to your colleagues, right? You talk to your peers. That's sort of step one. Like sort of an obvious step two is therapy, man. Get clinical help, get professional help. There's zero shame in that. Like, get that on board ASAP. You know, like if you think you're gonna struggle with the situation, or you know you're struggling with the situation, go talk to counselors. That resource is readily available in every hospital, especially if you're a student. You know, there's lots of resources for students. Yeah, it's not just okay to seek help, it's preferable. It's healthy, it's good to seek help. 100%, man. And like, even if you like think that you're gonna have a problem with that, you know, if you think that's like watching somebody die or like feeling somebody die, worse yet, you know, like you're doing compressions on them and you just like, you know, or taking their pulse or whatever and you like feel them die, like if you think that's gonna be like overwhelming for you, then start talking about it early. It's super important. And there's nothing shameful about that, you know, like your mental health is super important. Paramount even. Because if you're not right in the head, you're gonna take shitty care of your patients. You know, you don't belong there. So you need to, you know, get everything straightened out and make sure that you're not that way. You're not a burden, you know? Does my first death stick with me the most? No, I honestly don't even remember my first death. But some of them hurt more than others, for sure. With EMS, you have protocols in place that automatically kick in after traumatic events. Yeah. And yeah, Denny raises an excellent point that there's sort of like a, you know, like a dude man bro syndrome where, you know, like it's not okay for men especially to seek mental health help. That's total bullshit. Like that's crap. And I think honestly that attitude is kind of waning, but it's still there. But so yeah, like build your support structure. Have I ever sought mental health help? Not for that reason, but yes.
Who'd have thought those bleating bastards?
Also, like having family members who didn't seek help for their issues, right? Yeah, because again, it's stigmatized, right? Like it's not okay to you know, just not sort these things out on your own. Medicine's a field where seeking help is generally looked down upon? Yeah, absolutely. Totally true. 100% agree with that. It's okay to not be okay. Yeah, it is. Like, watching somebody die should be traumatic on some level, right? Like, that's a shitty thing to go through. I mean, obviously, like, well, so I was going to say obviously it's worse for them, but that is not necessarily the case, right? As I have said many times on this stream, death is not necessarily the worst outcome. Like sometimes these people are way better off not being in a hospital for, you know, withering away. But yeah, like it's traumatic, right? It's totally traumatic. So, you know, seek help, cope how you can, acknowledge that like those feelings are there and they're okay, and you know, talk to the people around you, because again, they've all experienced that stuff many times, and then, you know, get the help that you need. And if you need to like take a day off work or something, like that might not be a possibility, just depending on your circumstances, but you know, save up for a weekend or whatever where you can like go have some me time or hang with friends, or you know, whatever you need to do to kind of like set your mind right and sort of process what's going on. It's really, really important that you do that. And like journaling is a great way to sort of collect your thoughts. You know, if your mind's just like spinning, you're like, holy shit, I spent this week, you know, and I watched 15 people die, and like this person died on the table while I was operating on them, and holy shit, did I mess up? And you know, did I cause this? Did I cause harm? And just like write down all these thoughts, you know, that like sometimes just the act of like having those thoughts like organized helps you sort through them, right? And at the very least, you can have them all written down so you don't forget about them, like forget to address them when you have like a counseling session or something. Yeah, journaling is it's a very effective way of and you know, it doesn't have to be journaling like literally, right? You don't have to carry around a journal to write in. Like you can just like have a Word document that you like type your thoughts into, right? Like if you think of something, you just like type it into a Google Docs or some shit and go on your way. You know, it doesn't, you don't have to do like Dear Abby kind of nonsense. But if that's your jam, then sure, whatever works. But I'm not saying that in like the literal sense, right? I'm just saying have a place to like collect your thoughts. Yeah, iPhone Notes, exactly. Yeah, I personally have a Google Docs that's just like a kind of an everything document, and I mean, I wouldn't call it like a mental health journal by any stretch, but you know, it's where I like write down stuff that I need to do, or like important numbers or something like that that are like going to be eminently useful to me for whatever reason. It's just sort of like an everything thing, or like grocery lists or whatever. You know, just mundane crap that needs a place to go so I don't forget it.
When I'm ready and not
You realize you can't save everyone? Yeah, you totally can't save everyone, and you probably shouldn't save everyone, like I was saying. Like, that is not necessarily in their best interests to just be alive, right? We kind of lose sight of that. And lots of people who... So, when people say do everything, you know, meaning save, like, keep my loved one alive at all costs, they, like, almost guaranteed don't know what that looks like, right? Like, that's... You're basically dooming grandma to a really long, slow, painful death. She's gonna have dog shit quality of life for the last month or so. You can keep somebody alive with a feeding tube and a breathing tube for a long time, and they'll eventually die of either ventilator-acquired pneumonia or bed sore, or UTI. But they will have zero quality of life. What if you're emotionally numb? I mean, you kind of get that way, honestly. You get that way sometimes, and you know, whether or not that's bad sort of just depends on, you know, how far we're taking this. If you're like approaching sociopath, then yes, absolutely that's bad. But if you're just kind of like, well, that's another one, you know, maybe that's sort of a, you know, version of healthy coping. Yeah, like, I mean, if you like generally do not give a shit that this person just died, or like was maimed or something, like that's probably bad. But you know, if you're just like, it's not really like affecting your day-to-day life, then that's probably healthy. Lots and lots of dollars in a vent farm, yeah, exactly. Yeah, I mean, that's contributing to healthcare costs, right? That's just like sunk cost, totally. Yeah, you definitely have to be numb to a certain degree to function. Because like I said, you see this stuff all the time, like especially in anesthesia or surgery or something. Like you're gonna witness people die constantly. So you've got to be able to like handle it on a level that still lets you perform your job appropriately and in a safe fashion. What's wrong with being a sociopath? Nothing, I guess. Let's see. Was getting that kind of help from a resource amazingly beneficial, drastically eye-opening? I would say kind of halfway between those two things. I wouldn't say that it was like a revelatory experience, like getting professional help, but it was definitely like, I'm trying to like tie this up in a package. So it was mostly useful to just like process what I was thinking and feeling. Like to have somebody kind of like reflect what I was trying to communicate and like organize my own thoughts, like with somebody who's trained to do that. That was by far the most useful thing, in my opinion. Yeah, and emergency medicine, you still have tons of people to take care of. Yeah, exactly. Like I was saying earlier, like I manage 4 operating rooms at a time, right? So if somebody eats shit in one of them, you know, like usually there's one of my partners around who can just like, you know, kind of cover stuff for a little bit while I'm dealing with whatever disaster is happening, you know, in the bad outcome room. But, you know, ultimately, that's you got to get back in the saddle and start taking care of people again. And so that's where the like, you know, shared experience coping comes in, where you can just kind of like lean on people and everybody in the room knows it sucks. Maybe you hug it out a little bit. Like I know the last patient that I had who died on the table, the anesthetist took it really hard, and she's awesome. She's easily one of the best we have. I mean, she's very, very good, and she was really, really upset. And this lady was moribund. Like she had a ruptured aortic aneurysm and was like actively bleeding into her belly, basically. And we took good care of her, but she just died anyway, and there's nothing we could have done. But again, she took it really hard, and I was just like, dude, you did great. Like, you set this case up super fast. We had all of our equipment. We did everything that we needed to do. You know, we resuscitated her the best we could. And so what happened is we stabilized her, and she bled out in PACU. Like, her repair failed, and she bled out. So I was like, you know, we did really well. Like, the fact that we even got her out of the operating room was, like, amazing. And so we just kind of, like, talked about it and, you know, went to bed. And everything's, like, you know, I don't want to say everything was cool, but, like, you know, it was kind of settled. Another character? Yeah, this is a Frostblink Ignite Elementalist. Going super smoothly, actually. I'm pretty squishy, because I have no defensive auras right now, other than Purity of Elements, but it is zoom zoom. Making a mistake that leads to death, that is hard. I don't think that I have personally ever done that. I've definitely, like, done some things that were, like... I don't know if it was necessarily, like, harm, but definitely, like, suboptimal. I guess you could say harmful, because it, you know, like, caused somebody to maybe have, like, an extra day or two in the hospital. But nothing that was, like, a maiming or deadly mistake.
When I'm ready and not before.
That I can think of, at least. Or that I'm aware of. But yeah, I know, a friend of mine, actually a really good friend of mine, just had a patient have a stroke during a carotid endarterectomy, which is a very, I mean, well, it is a well understood complication of carotids, right? Because you're, like, working on somebody's brain blood supply, so if you mess that up, you know, clearly they have a high chance of having something bad happen. And it was not his fault, but he still, like, kicks himself over it, you know? Like, just wanting to be better. Wanting to, you know, improve what he did, or, you know, trying to figure out if there was some way to improve his care. Which, in my opinion, there's not. We've talked about it. Like, I don't think there was anything to be done. It's just that the person probably had a little chunk of cholesterol break off and go into their brain, and there's just nothing you can do about that sometimes. So, I mean, even if it's not your fault and something bad happens on your watch, it still sucks, right? It's very easy to take that to heart. How often are slow codes run in med these days? So for those who don't know what a slow code is, it's basically where you're like, this person would be better off dead. And like, you know, like that is their optimal outcome in this situation. And so we're not gonna, like, full court press resuscitate them. So yeah, slow codes are kind of you know, a way to like give somebody a merciful, like dignified end without shattering their ribs and, you know, making them a human science experiment, in my opinion. So everybody, you kind of like show up and you meet the standard of care, and then just kind of like let the person die, basically, is what happened. And I would say that those are, like, especially with COVID, like COVID recently, there's been a lot of that. Because those patients are just, there's no resuscitating them, basically. You know, they've already been in the ICU for a month. You know, like, they're not gonna just randomly get better. So, you love life right now? You should. You have a great life. Oh, I missed a Discord comment. At least in the US, the procedures get billed much higher than goals of care conversations. Oh, for palliative? Yeah, absolutely do. Absolutely true, which is a shame. Patients with COVID history, desatting during intubation? Yeah, I know, right? Well, yeah, you should feel really good about yourself. You have a great life, man. You got medicine, education paid for. Ooh, that's a lot of cash. Sweet. You know, you're on your path to a really good, high-profile career. What's not to love, right? Yeah, the good memories do help out for sure. Alright. You, sir, may have this shield. It's a pretty good shield. Thanks, man. Nipple blades. I just traded with nipple blades. Heyo. Yeah, it's inevitable that you'll go up and down, right? Yeah, totally agree. That's just like, you have good days, you have bad. And sometimes you have good stretches, and you have bad stretches. Like, I had a real bad stretch over the past, like, 3 weeks or so. I was getting worked super hard, had a lot of bad outcomes, really sick patients. It's tough, man. But, you know, again, you have to fall back on the fact that people around you know what's going on and can help you. Denny should go into psych? Totally. Dude, I still support psych as sleeper OP, man. I think psych's a pretty good career if you do private practice. Like, well, it is a well-balanced career in terms of lifestyle and pay. You hated an inpatient? Yeah. No, I don't blame you there. Inpatient psych is awful. Isn't psych reimbursement also going down? I don't know. I don't know the answer to that. Possibly. I mean, the reimbursement for everything is going down, dude. Yeah, I mean, psych takes a special kind of person, for sure. Oh, what the hell? Oh, yeah, the portal's here. Don't say reimbursement's going down. Well, I mean, still, like, private practice rates are like $400 to $500 an hour, dude. Like, oh, yikes. That's, you know, you will still be paid quite well. So if you've got a busy clinic, man, you're raking in the money. You're doing just fine. Private practice PM&R, here I come. Hell yeah, man. PM&R's good too. PM&R's kind of like slow moving for me though. For those who don't know what PM&R, it's basically a rehab. Physical medicine rehab.
When I'm ready and not before.
And so you help people primarily with like long-term rehab and stuff. So you have the same patients for a really long time and work on plans and stuff for them. I'm definitely more of a fire and forget kind of guy. Like, get something done fast, go home, leave work behind. no continuity of care. That's my thing. But, you know, I get it. If you want a slow-moving, minimal emergencies, very safe, very comfortable sort of practice, man, I totally understand the appeal of that. Because again, you know, like we're talking about, you will have less, or you will have fewer of the incidents that we're talking about that are, you know, traumatic and that you need to work through. It's sort of like less of a mental grind in many ways, you know, just from like day-to-day life and the like crazy shit that you see. You live once, better do what you like? Yeah, absolutely. You want to do your PhD? Ugh. PhD sounds terrible. They called a stroke alert for somebody that vagaled when pooping? Nice. Yep, that actually happens a lot. Very unlucky. Dude, it's amazing how many people vagal from like, they take a poop in the middle of the night and they stand up from the toilet and vagal and break their hip. Happens all the fucking time. It's unbelievable. Take a good balanced poop. Nothing quite like a good balanced poop. I love it. What's vagaled? Oh, yeah, sorry. So that's me assuming everybody knows medical terminology. So it's your vagus nerve is attached to your carotid arteries, to a specific part of them called the carotid body, and it's a baroreceptor, which means that it senses your blood pressure and adjusts it accordingly. So when old people especially stand up, they get orthostatic, which means that their blood vessels cannot adjust fast to the fact that they're like messing with gravity, right? So like when you're sitting, all of your blood kind of like pools differently. And then when you stand, everything kind of flows to your legs. And so like their blood vessels aren't able to compensate for that, so they get decreased flow through their carotid bodies, and their vagus nerve tells their brain that they like are having trouble and need to like vasoconstrict hardcore, and as a result they get like weird like blood flow shunting basically. So their blood pressure drops catastrophically and their heart rate can drop, and to like make their heart fill more because their body thinks that their heart's not filling, and then they fall over and pass out. So that's a really long explanation for why when you stand up you get dizzy. That's what's happening. And now you know. 10th year in your program? 10th year? The what? 10 years? Dude, that sounds terrible. What the hell? Yeah, we'll take Frozen. He did a 6-year PhD. Yeah, wow. I don't even know why, but don't do it. I 100% agree with that.
Hold on to your cockles.
PGY 28. I'm already in it, oh no! 10th year in MD PhD. Oh my god, that's so much school. Holy shit. Holy shit, that's so much education. PGY stands for Poggy. No, it does not. It absolutely does not. That is like the opposite of what it stands for. Oh man. Yeah, so that's actually another thing that we should touch on, right? Residency. It sucks. It sucks ass. So that's something that takes a lot of coping in itself. Like, you're going to be working super long hours while you're seeing all this terrible shit happen to people. You know, your family, your friends, your relationships will all suffer to some degree. You know, maybe they won't, like, be damaged, but they're not going to be the same while you're in residency. And that's really tough for most people. It's tough for me, for sure. And, you know, you gotta figure that out, because it, you know, sometimes if you're like really struggling, you got a year left, maybe you can get it out, but damn, dude, like, seek help. Get somebody to talk to and figure that stuff out. That's really, really important. You knew 2 people that did a PhD and went back for their MD? That sounds awful. Everything about that sounds awful. You know, the best part about getting an MD PhD is that you're so much more employable and you get a whole lot of extra money for doing it. Nope. No, you don't. No, you don't. And no, you aren't. That's the weirdest thing to me, honestly. Like, I conceptually understand that there are people who, like, really want a hardcore academic, like, research track, and for them to really climb the ladder, an MD PhD is necessary. But, like, for most people, if you want to do research, just get your MD and do research. At least more doors are open. Yeah, I mean, it's not like it's not a total loss, for sure. Like, if you're the kind of person who enjoys doing that research, I mean, like I said, you know, if you want to make a academic career at, like, Hopkins or something, then I don't know if it's a hard requirement, but it's pretty much a requirement to have an MD PhD. Yeah, it's like, that's really important to have that sort of qualification. Yeah, they do pay for med school, but shit, they better, man, because you're incurring, you know, 3 years of attending salary opportunity cost at least. You know, so yeah, they pay for med school, but you're also eating $1 million in lost salary. So, is that worth it? Probably not. Oh, damn it. Okay, well, that's what I get for typing while I'm trying to do something. There we go. Some non-MSTPs are fully funded. I think most are, was my understanding, but I'm sort of overreaching my knowledge there. Harvard only funds some of its students? Wow, that sucks. Man, that's sort of like what's the advantage of doing that then? There's one that only funds PhD in M3 and M4? Wow, shit. Well.
When I'm ready and not before.
Harvard advantage is that you're at Harvard? Yeah, well, fair enough. Oh, wait, so you're like a second-class citizen, too? The, like, fully funded people get to go to different stuff? Well, that's fucking bummer. Jesus. So is that almost like the scholarship crowd kind of thing? Like, the people who are fully funded, it's like they sort of functionally treat it as like an honors program? DDS to maxillofacial? Oh, I think that's amazing, dude. That is also a shitload of education, but those guys are badasses. I just have a lot of feelings. Yeah, they get really good training. And they do something that I think all surgeons should do, which is 6 months of anesthesia training. And granted, like, most of it is, like, what we call MAC. So it's, like, really deep conscious sedation. And that's, like, a contradiction in terms, technically speaking. But, like, you're not, like, putting breathing tubes in people and stuff. But yeah, like, they learn how to sedate people adequately. And I think surgeons should have to do that. Just like I think anesthesia should, like, have a couple months of surgery, at least in their intern year, like maybe 2 or 3 months. I mean, I know that, like, functionally what would happen there is basically the off-service residents would just get mercilessly abused, because that's how it goes. Because they don't have to give a shit about you since you're, you know, not part of their program. So you just get brutalized while you're on your surgery rotations. But, like, conceptually, it would be really useful to understand, like, what the people across the drape are working with. Is surge that bad for residency? It can be. Yeah, definitely can be. Your hospital's pharmacy granted a ketamine. What the fuck? That's terrible. Could I do a gastrectomy in emergency? No. No way. That's a really complex surgery, dude. Any surgery that I would be competent to do would never be an emergency. What does anesthesia training do versus surgical that's different? I mean, lots of stuff. So, I mean, obviously the two dovetail a lot because you have to work together. But, like, what anesthesia does is very much less procedural. It's a lot more cerebral. And that's not to, like, you know, cast a, you know, grease monkey light on surgeons, but, like, you know, that's a much more skill-based thing than anesthesia is. Like, all the procedures that I know how to do are super simple. Like, I could probably do a hernia repair right now, even though I haven't done one in 10 years. I'd probably do a really shitty job, but I could do it. But, like, everything that I do is a, you know, 5 to 10 minute procedure, tops. Putting central lines in people, doing epidurals, that sort of stuff. But yeah, surgery is definitely much more tactile and skill-based. And what I do is, you know, disaster plan, essentially, where I have to think through all of the, like, bad shit that can happen to a patient, and you have to know the steps of the surgery to anticipate these things, right? So you have to know if there's, like, any sort of, like, choke point to where, you know, something super bad could happen. Like, a great example is heart cases. So, like, when somebody goes on and comes off bypass, the bypass machine, like, they can do very badly. Like, terrible shit can happen. So you have to be prepared for that and, you know, dial in your plan accordingly. So you have to have a pretty deep understanding of, you know, how the surgery is going to go and how their medical comorbidities interact with that. Whereas with surgery, you know, kind of have to understand those things as well, but you're not on the end where you have to fix it, you know? You're just wondering why surgeons should do the training? Yeah, I mean, I just think it's a good idea to, like, get a better idea of what the people you're working with every day do. Not necessarily so you can do it, just so you have a more functional understanding of exactly what's going on in the operating room. Pimp the doctor with random Inky card facts. Oh, I'm gonna do really bad on that, dude. That's like, are you smarter than a 5th grader, right? The answer is no. I don't remember any geography or anything like that at all. Your faculty for cadavers loves pimping? Great. That's so fun. So I know the difference between a direct and indirect hernia. So, let's see. Direct hernia is, like, through the, what is it? I know it's, like, through the femoral sheath. Well, that's, no. I guess the short answer is no. I don't off the top of my head. I would, like, instantly recognize it if I saw it again, though. That's a pretty basic one. Tell me the different types of spina bifida. That is actually one that is sort of relevant.
When I'm ready and not before.
Occulta is the one that you see most often. I actually don't know what the other ones are called. But generally, like, especially if you have somebody with a, I can't remember what you call it when the, like, spinal cord's exposed and out in the sack. Since 9/11, where was I? I was buying a pencil. I was buying a mechanical pencil as my junior year in high school. I remember that very vividly. When I first heard about the planes hitting the towers. There's one with anencephaly. Yeah. It's myelomeningocele. That's what I'm looking for. You like how I pulled that out? That's like extreme spina bifida, where your spinal cord is like actually outside of your body. Like the meninges and stuff are actually like uncovered. Was it a good pencil? It was the best pencil. Best pencil ever. Boomer using a pencil, yeah, that's me. Oh, they thought they had cerebral palsy until her mid-20s? Really? I mean, cerebral palsy is like, you know, generally comes with some sort of, you know, like mental, like developmental disability. Not necessarily severe, but like it's there, right? But yeah, so I went to the bookstore and got my pencil, and there was, like, I was going to French class. And I went to my French class, and there was this dude in there who, like, he's kind of one of those people who, like, it's like Nelson in The Simpsons, right? Just sort of, like, thrives on making fun of other people, like, even if there's really nothing to make fun of them about. And at the time when I got my pencil, the, like, that small commuter plane had like just hit the Pentagon, and they were reporting it as like a bombing at the Pentagon. And I went to my class and I was like, I just heard that the Pentagon got bombed. And so he like starts making fun of me, and like he's like, the Pentagon didn't get bombed, ah, ha ha. And it's like, dude, why would I make that up? Like, it's such a fucked up thing to just like come into class and say, like, maybe I misunderstood, but we should probably turn the TV on and see what's happening. And so we turned the TV on and like saw footage of the second plane hitting, or the plane hitting the second tower. We were like, oh, this is really fucked up. What's going on? She had issues with her gait. It got slowly worse over time. Interesting that it got slowly worse over time. I wonder why that is. I mean, because, like, spina bifida is kind of like, you got what you got, right? What grade was I in? 11th grade. I was a junior in high school. Got worse with puberty than stopped. That's interesting. So puberty, I would actually expect a condition like spina bifida to get better with puberty, because so like throughout childhood development you only increase, or well, I guess I should say throughout your growth as a person you only generate new neurons at 2 points, not points, 2 phases in your life, and generally that's between like 3 and 6 and during puberty. So, like, I would have expected, you know, some, like, regenerative process to happen then. If anything. But, I don't know. Maybe not. Maybe she had some, like, her spina bifida was such that, you know, like, use of her spinal cord was, like, causing compression or further injury or something like that. Who knows? I'm just speculating here, but... You're about to board a plane at Logan? Whoa, on 9/11? Oh my god. I bet that was crazy. Holy shit. What an awful time to be flying. Did he die? No. Maligaro, the artist. You were too. Secondhand story for your mom. Okay, fair enough. Yeah, that was a crazy ass day, dude. I remember it obviously very well. So yeah, I hope you guys don't have incredibly traumatic experiences in, you know, your clinicals and stuff, but just know that that's pretty commonplace, right? Went to the memorial in 18. Yeah, I actually might have been 18 for me too. No, it was 16. It was 2016. Because I was in New York for a board review class, and the review class was dog shit and a total waste of my time. But I chose to go and see the sights instead of going to the review class. Hospitals looked like on 9/11. Probably not great. That was probably really not fun. I would imagine. Yeah, I can only guess. We actually, there was a restaurant, like a actually pretty nice restaurant, that their gas line exploded when I was a third year resident. I think it was my third year. And there were like 40 people injured because it's like right in the middle of this like pretty busy commercial district. And like we could hear the explosion. I heard the freaking explosion from the bowels of the hospital. And that was a catastrophe. Like we were all there till like 8 p.m. and like shit was on lockdown. And I mean the explosion was less than a mile from the hospital. Probably about 3/4 of a mile from the hospital, so like really close. So we got most of the people who survived. But it was a huge deal. I can't even imagine what 9/11 did. How often am I called for an emergent intubation that someone else can't get? Not very, fortunately. Not very often at all. That actually has not happened for... Well, it hasn't... It's happened during the day multiple times because we actually... our hospital's really weird and we don't really have many intensivists in the ICU. They're just kind of like pulmonologists who go there. Oh, he's here. Okay. And because of that, they're not like really prepared to do procedures like that. What is this? That's a shitload of accuracy. So yeah, we get anytime somebody needs like a central line or an arterial line or a tube, we get called, even if it's not difficult. Yeah, fortunately, the policy of my hospital is emergency medicine takes care of all that shit. Like codes, intubations, etc. That's all their deal, which is amazing. Fucking great quality of life. What's IR like? Oh, great. They have awesome hours. And they can they refuse to come in when they're on call all the time. So I don't know, I don't know what they do. I don't know, why are they on call if they don't come in? Creeping in anesthesia scope. Hey man, have it. Enjoy. You have at it, brother. You have all those late night intubations that you want. But the ER docs at my place don't place lines. Like, they hardly ever put lines in people. And in fact, the nurse manager told me that they are not, quote, not skilled enough. He actually said the words not skilled enough to place those lines. It's like, what? What? We have an emergency department that can't put an arterial line in somebody? Are you fucking serious? IR does seem really cool. Yeah, IR seems like a really badass field, to be honest. I mean, you know, you put yourself at really high risk for, like, cancers and arthritis and shit. Which is terrible, but... Oh, my goddamn alarm. This is my alarm that tells me to raid somebody when I'm done streaming. Which I probably should just delete. Oh. I was trying to do that without dying. Oh well. I should probably just delete because I don't really do that anyway. So, is it a porn star? It's totally a porn star. Oh, the Hereditary Angioedema tube? I don't remember that. So, for anybody who doesn't know what Hereditary Angioedema is, there's a class of medications called angiotensin converting enzyme inhibitors, or ACE inhibitors, that, without going into a huge long discussion, basically like mess with an inflammatory chain. And some people have a deficiency of a certain enzyme that basically makes that, when you block angiotensin converting enzyme, it makes their inflammation go out of control, and they swell, like hardcore freaking swell, and their airway swells shut, and it is a massive emergency to get a breathing tube in them. Like, sometimes they swell so much that you can't even trach them, because their whole trachea is swollen, so it's really important that you get, like, you know, something rigid, like, in their airway to secure it as soon as possible. It's fucking nuts sometimes. So yeah, that can be a super hardcore situation. I actually had a patient when I was in residency who got angioedema during her period. That is the worst shit ever. What an awful thing to have happen. And she was like, oh yeah, I've been in the ICU like 15 times because of my period. It's like, what the fuck? This is a terrible accident of fate. Patient was swelling, couldn't palpate the landmarks. Got a 6.0 uncuffed tube. Yeah, 6.0 uncuffed tube is really small for an adult. That's like probably what you would put in like a tween-ish. You know, like an 11, 12-year-old, something like that.
When I'm ready and not before.
Oh, come on. There we go. Yeah, angioedema is scary. I do not like it. Basically, anytime it happens, you call ENT to come in and be like, hey, guess what? You get to emergently trach somebody, and we hope it works. Yeah, you're gonna have a really good time in med school, man. Like, it's kind of a shit show sometimes with like all the pipping and stuff, but you got so much experience that you'll be on the forefront of people letting you do stuff. You just have to make sure that they understand you have that experience. You don't have ENT in-house? Yeah, I mean, we usually don't after hours. We definitely have them on call, for sure, but it's kind of hard to get them to come in. I think they'd come in for an angioedema, but... yeah, they're, So one nice thing about private practice is that most of the time, when you do a case in the middle of the night, like, you know, obviously it's really inconvenient, but you can rest assured that the surgeon is more pissed off about being there than you are. Which is great, you know, because you're like, oh yeah, you don't want to be doing this either. Whereas academics generally attract people who are just like fucking workaholics and crazy, and will just like spend their entire lives working if they can. I mean, there certainly are some of those in private practice too, but generally they don't want to work after hours. Like, they may work, you know, 12-hour days, but they go home at 7, you know, and then they're done. Yeah, they don't want to be there at 2 a.m. doing shit. Talk to a neurosurgery interest group? And they asked if you like to go home. You said no. Yeah, good answer. That's the correct answer for neurosurgery. Some days you don't have urology during business hours? Wow. That must be a small hospital, man. Urology's kind of like bread and butter stuff, man. There's so many people who've like smoked and gotten bladder cancer and stuff. You're gonna start Euro research? Dude, urology's a great career. I liked urology a lot more than I expected to. Can you imagine if I played this game on hardcore? That'd be the most frustrating experience ever. Holy shit. Oh, 170 bed hospital? Really? Dude, my hospital's like about that size. We've got all that shit in-house constantly.
When I'm ready and not before.
You don't understand anything about this game? Most people don't. This is like one of the most complex games out there, to be honest. It's extremely new player unfriendly, and they've actually like purposefully made it so. I mean, this is the skill tree, dude. Like, what do you make of this? You load up the game and you look at this and you're like, what in the flying fuck am I supposed to do with that? You know, there's basically an entire program run by the community that's dedicated to character planning, which is this. This is this character like in completed version. So here's like all your damage calculations and stuff, and you have to know if these numbers are significant or not. And here's all the different like skill gems and all the stuff you can do. And like this is the list of skill gems. Do 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 do, and all of these interact in different ways, right? That's how many skill gems there are. Yeah, this game is complex as fuck. Like, usually with most games, I really enjoy figuring stuff out on my own. And at this point, like with this game, I'm experienced enough with it that I can do that. But if you're starting out, there is just no chance that you're gonna make a build that's worth a shit. You're gonna have a really bad time, and you're gonna hate yourself and want to quit. So you pretty much need to use a guide. But then the problem is, there's a lot of trash guides out there that are not gonna help you. And so you have to kind of figure, that was cool. You have to figure out which ones are in fact good. Why do I play? Oh, I like it. Like, I've been playing it for a long time, so I understand the game. But getting into it is like, I can't even imagine how hard that is. And not too long ago, so there's 10 acts. Not too long ago, the developers made it, like, they made a deliberate change to make the first 2 acts really hard. Well, the first act in particular. Like, they upped the difficulty of the first act, and I have no idea why, because it is, like, really hard. It's very front-loaded. And so on top of, like, all this intimidating, like, skill tree buggery and stuff, you have this incredibly difficult first act. I don't really know where they were going with that. I'm not sure why they thought that was a good idea. Is it you just, like, instantly alienate people who would otherwise play your game? Where the hell am I going?
When I'm ready and not before.
But yeah, actually, like, one of my favorite things is trying to figure out the game, like, through this program. Because there's no way that you can just, like, mentally theory craft builds in this game. It's way too hard. There's too much going on. But, like, I like the complexity. I think that's really cool. Am I supposed to go this way? Where am I going? This zone is crazy. It's so big. Okay. Nope, that's the wrong way. Let's go back here. Do. Your school's academic support department has a document for you? Do they? Don't leave me hanging, dude. What's it called? What is the document called? Oh my god. I have to know. Relaxing songs. Loud noises! Any stigma about ADHD in med school? I don't think so. Not that I'm aware of. There's certainly a lot of people snorting Adderall. They appreciate the treatment for it at the very least. You might have ADHD but never got diagnosed because everyone has trouble focusing. Yeah. I mean, yes and no, right? That is not. Not, like maybe true, but not a useful thing to say. It's like, you're not depressed, everyone gets sad. Like, okay. Oh, fuck. That's not good. I have to run all the way back there. Just tell you you're not working hard enough, even though you do. Well, dude, it's all about working smarter, not harder. And I will tell you that much. And you can definitely train yourself to focus better. You know, it is a skill for sure. But, you know, if you're just like constantly off the wall and like literally unable to focus, then maybe you should look into that, you know, as a medical issue. Great stream, thanks, man. I appreciate you coming back. I hope, or coming out, I guess, not back. I appreciate you finding me. Yeah, I hope you come back. I will be here on Wednesday because I am off this week and a week of very hard-earned vacation. Oh, I didn't get the fireflies. Fuck. Need to go here. Psych had you do a series of cognitive assessments to evaluate the different parts of attention and memory. 24-hour stream. No, God, no. That sounds awful. Yeah, so I thought psych was actually pretty interesting. But I was at the mental hospital. The state mental hospital. So everything that was there was like the most extreme version of every mental health problem, you know? Like everybody there was just like, I mean, it was like exactly what you would picture a sanitarium, you know, but obviously like more humane. Just like people screaming constantly and like randomly laughing, people like drawing giant dicks everywhere and, you know, thinking they're Jesus and all sorts of stuff. Like, I mean, it really was. It was crazy. Normal depression, anxiety, plates get old? Yeah, probably so. I mean, every specialty has their benign nonsense, though, right? Like, the vast, like, 99.5% of what I do is walk into a room and stand there while somebody else places a breathing tube in somebody. And then I leave and go do it again. And I do that, like, 20 times a day, right? Maybe one of those people has something go wrong that, like, actually requires my attention, but usually not. So, I mean, yeah, you know, there's stuff that gets dull. Blood pressure checks, pediatric well checks, anxiety, depression, and for psych, right? It's all, you've all got your, like, mundane, bread and butter daily nonsense that you're gonna have to go through. It's just, which nonsense do you have the highest tolerance for? If I had to pick one thing that would determine if a candidate would be admitted to my program, what would it be? So that depends on what you mean by my program. If, well, no, you know what? Actually, it doesn't. If we're talking about medical education, that one thing is, would I be willing to work with you? Like, can I work with you? Would I want you as a colleague? And if the answer is no, then fuck off. You have no shot. And that's one of the hard things about interviewing, right? Is like, part of it is like clicking with the people who interview you.
Ready and not before.
But like, medicine's such a small world that you have to, that's an extremely important criterion, is being able to work with and around people. So we're hiring right now in my group, and it's extremely important to us that, you know, whoever we hire gets along really well with everybody and will, like, you know, be a good team member, because there's only 7 of us and only 5 of us who show up every day for work. So, like, if you've got a bad seed, it's super evident and everybody feels it real hard. Do I think you should mention more about personality with that kind of question? Not necessarily. I mean, if you, like... It's not, like, necessary to explicitly describe your personality. It's, you know, you talk about your hobbies and, like, interests and things like that. That pretty well does it, honestly. And, you know, the tone that the interview sets, and if you're honest and just seem like a real person, that'll go a long way towards convincing somebody that, you know, you belong.
Till next time, shall we keep?
Do you need an MD to get the job? No, I think my group is actually mostly DOs. Let's see, there's 1, 2, 3. I guess that's not true. There's 3 DOs and 5 MDs. But if I had to pick the most badass member, he would be one of the DOs, the guys who's cardiac trained. He's awesome. Start your interprofessional class sometime this month? What does that mean? Integrated with PA, Pharm, and PT students. Oh, okay. I had good experiences with interdisciplinary training, to be honest. Like, I know there's lots of people who, like, super begrudge, like, nurse practitioner and PA students, you know, opportunities for, like, procedures and things like that. But, dude, that's small potatoes, man. Like, that is really not a big deal. Like, they've got to learn how to do that stuff, too. I mean, when you graduate, do you want a PA under you who can't do anything? The answer is no, you don't, because that sucks. Like, it may seem shitty while you're trying to learn the procedure, but I guarantee you, you will get way more than you need in residency. You will get flooded with that stuff, whereas they will not. So, you know, they just have 2 years. You've got, like, 8. Or 5 to 8. And it's going to be more intense, too. Pharm students were kind of weird. Yeah, I think pharmacists are kind of like just a step above pathologists, right? They do rather enjoy a good mom's basement / dark room. Looking for another future DO? Yeah, absolutely, dude. We're looking for good people who will do the job and get along. Iram, oh shit, what's up, man? How are you? What's going on? It's good to see you back to the streaming world. Long time no see. You'll be joining my practice as a dermatologist. There's a lot of use for that in my anesthesia group. Yep, that's perfect. Totally useful. Where am I gonna go? Let's go down here. Get some faster ignites. You'll be the neighborhood researcher. Beautiful. Emergency medicine anesthesia dual residency. Yeah. That's another way to spend way more time in education for 0 benefit at the end. Good for you. How's my family doing? My family is great. I'm about to add one to it, in fact. My wife is due with a girl in December. But yeah, we're doing awesome. My kid started kindergarten and loves it. Yeah. Good times. Pathology is that isolating? No, it's really not. I mean, you're just in the path lab. You don't really see any other physicians, really, other than other pathologists, but, yeah, I mean, it's just a joke. What would I call the profession of Dr. House from House MD? Internal medicine. TV trauma, yeah. Thanks, man. I appreciate it. Yeah, our first time was a little rough, so I'm kind of hoping this time's a bit smoother. In terms of the baby days, but when am I gonna get fixed? Dude, I've been freaking trying to do that for like the last month, and the urology office won't call me back. Like, I've applied for, they have like an online appointment, you know, scheduling service, and that didn't give me an appointment. So I've called their office 3 times, and I can't ever get anybody to call me back. Even though, like, I personally know all these doctors. I work with them every day. I can't get an appointment. So I think I might just, like, finally throw my weight around and be like, guys, can you just, like, get me an appointment, please? I just need to have my balls snipped. That's it. Let's do it. I can't pull out, man. There's just, like, way too much power for pulling out. Go in and put it on their desk. Like, fix this! Jesus Christ! Get your goddamn scalpel and fucking fix this! How am I liking anesthesia? Oh, I love it, dude. It's a great job. Like, I like everything about it, honestly. Like, the pace of the work is great, because it's like, you work really hard and get your shit done, and then you sit down and cruise. Call is hectic, but then you have a day off. You know, we get a lot of vacation. Pay is really good. Fix my meat! Please, fix my meat! You've been in anesthesia and think you want to do it? But yeah, I mean, it's a lot different than a lot of other specialties, because it's all, like, you never see your patients again. You know, unless they come back for other surgeries, which I think is amazing. I don't want any continuity of care. But yeah, I mean, it's really nice to just, like, show up and, like, get your shit done and then disappear and nobody knows who you are. It's amazing. It's so nice. I love that. Yeah, the pace of work is extremely fast. You are handsomely rewarded for efficient work. Wait, did I get all the... Lighting the way. Let's see. I guess I didn't get all the fireflies. Don't they have me working in the ICU? So you can do critical care as anesthesia. You actually take a pay hit to do so, even though you do a fellowship for it. So you spend an extra year in training to make less money, because that makes sense. But yeah, you do end up doing a lot of critical care, because they call you to, like, fix people who are crashing and all that sort of stuff, even if you're not, like, critical care certified. All of academic med, yeah, more work to make less money. Makes perfect sense, right? Say you have this, like, $500,000 opportunity cost, and as a result, you decrease your salary. That's pretty fucking cool. If my kid didn't want a sibling, would I take that into consideration? No. Maybe minimal consideration, but I mean, 5-year-olds don't know what they want in terms of, like, long-term discussions. You love efficiency? How would I integrate technology for my career? Poorly. That's how we, so electronic medical records are, like, the name of the game in anesthesia. So, like, recently, basically all ORs have computers in them, and all of your data just, like, transfers to that. All of your, you know, vital signs and respiratory stuff and medicines that you're giving and, you know, whatever. And as much of it is taken directly from, like, all your monitors as possible. You usually have to manually enter all the drugs you give and stuff, but in any event, our EMR is really terrible. Like, it's very easy to use, but it's super inefficient, because, like, every time you change, like, a screen, you have, like, a brief loading time, and it just drives me fucking nuts. And there's not a whole lot of way around it. Like, you can kind of build some, like, rudimentary templates, but it's just, like, they're not good enough, and it's so cumbersome. Because the hospital tried to do a penny-wise, pound-foolish approach, and instead of getting, like, Cerner or Epic and, like, a high-quality EMR, they have, like, a whole bunch of different ones that they've kind of, like, patched together, and it's just bullshit. It works terribly. Would I encourage my kids to go into med school when they're older? No, fuck no. No way. Absolutely not. Especially with how things have changed. Like, it was bad enough when I went through, and, like, all of the... I mean, the red tape has gotten so much worse. It's amazing what you guys are having to go through now. Like, with all of the, like, Casper stuff and, you know, the kind of, like, de facto requirements with research and volunteering are just inflating out of control. And then on top of that, like, you're way less likely to get the residency you want. Like, the match is becoming so much more competitive. Like, nah, man, like, go into business. Make a fuck ton of money. Retire by the time you're 40. Enjoy your life. Don't be on call for 24 hours when you're 60 years old. Like I'm gonna be. It's all bullshit. Yeah, system is slow and inefficient. Not my favorite. Have 3 monitors with all these different records. Yeah, I mean it is actually. Yeah, you have your anesthesia machine that shows you all your like respiratory mechanics and stuff. You have your straight up vital signs, and then there's also like kind of like another panel that you look at, or depending on what kind of anesthesia machine you have. Like I guess we actually have 1, 2. Yeah, we just have two like main screens, but some have 3. Depending on what your setup is. But yeah, all of the information that's like electronic is just flows over automatically, which is great. It's like manual charting sucks balls. I did that for all of my residency except the last like 3 months. It's really shitty. It's very hard to like take good care of somebody and still write down everything that you're doing for them if like it's a busy case. Do not like. Probably gonna retire 45 to 50. I hope that's true, man. I would like to do that as well. Sounds great. They had equal opportunities for matching and I had to choose would I go MD or DO. Oh, I don't think it really matters. I'd probably go MD just because I wouldn't want to deal with the bullshit of going through OMM because I'd never use that. Maybe the money will be too good to retire. Yeah, I mean it might. Like at that point you're probably gonna be really well established and have an awesome practice if you do in fact do derm. You'd probably be coining 7 figures and not really ready to give that up. Don't want to compress people's 4th ventricle. No. No, I do not. Is there any benefit to going MD besides the higher match rate? Not really. Not that I'm aware of. I mean, I think there are some places that are still like anti-MD or anti-DO biased. So I guess you would avoid that, but realistically, that's not a thing. Life might be a little bit more difficult as a DO if you're doing academics. But that's not something I ever even remotely considered doing. Dude, Charleston would be a great place for derm. Lots of very wealthy people there who have probably tanned much more than they should have. Made a meme from the Darth Plagueis copy. Nice. I see your meme. Oh, it's too big to paste here? I guess I didn't realize Twitch had a text limit. That makes sense, though. I mean, you don't want people, like, posting a frickin' novel and annihilating your chat.
I need more mana.
Ah. Nope, that's the wrong way. Secondaries trauma, yes. God. Frickin' secondary applications, man. It's so bad. So expensive, too. Where do med schools get off charging freaking college students so much money just to apply? I mean, what a giant middle finger that is. Like, oh, you guys are super poor from 4 years of education and you're about to pay us $50,000 a year for an education that you'll get online? How about you pay us $150 now? That sounds good, right? Ah! You're State gives you 300 characters instead of 500 on Amcast. Nice. I don't have spam protection in this chat. I don't know, probably not. I probably don't. I'm sure somebody could come in here and just like drop in bombs and get me banned or something. So I think I had a language filter on for a little bit, but it was like draconian and not like letting people post anything. Oh, that bitch got eaten. Get out of here, Silk. You got fucked up. You need one with 200 characters? What is that? It's a tweet? They have like a secondary tweet? It's ridiculous. I want to school because... That's it. That's all you have room for. Oh, God. Yo hablo español. That's probably enough. That's probably enough to get in. There's a lot of shit going on the screen right now. Oh, my God.
When I'm ready.
There we go. Ah. There he goes. I have no idea what that says, but I'm going to assume it's... I speak Arabic, and not something that will get me banned. Originally going to write influence the flow of CSF. That's OMM. The technique it wasn't invented until after he died. Blasphemy. No language filter. Perfect. Don't tell them. Don't tell them. I should probably fix that. Yeah, you can tell that I put a whole lot of effort into my like community interaction in here. Like there's no freaking emojis or anything. It was nice job translating. That's because I'm so fluent in Arabic, actually. You guys didn't know that. You have stretch marks. Okay. There definitely is not a language filter in here. Awesome. It's good to know, though. I'm glad to hear that you have stretch marks. Oh my God. What have I gotten myself into? Yep, hot. Oh God, we made a love connection. A stretch mark love connection. What next? What next? Oh, shit. Hey, girl. Hey, girl. Oh, damn it. Good times and great oldies. Have you seen the How is Pregnant Formed videos? Doesn't ring a bell. But maybe I'm about to. Okay. Hang on, let me figure out a way to not just instantly die. And then we will watch that.
Am I pregnant? Am I pregnant? Am I pargant? Am I gregnant? Am I pegnate? Help? Is there a possibility that I'm pegrant? Am I pregnant or am I okay? Could I be pregonate? How do I know if I'm prengan? Can I be pregnant? Can oo get pregante? Can oo bleed while oo are pergert? Can oo down a 20-foot water slide pegnat? How can I get my GF pregnant? What happened when get Perginat? How can a 9-year-old get pregnant? Will my get pragnan? What is the best time to sex to become pregnant. Does anyone know
This
how
is
many
awesome.
teens get pregnant a year? Are these systems of being pregnant? Girlfriend ain't had periods since she got pregat. Is it possible having sex to a 8 months pregnant? If a woman has starch marks on her... Wait. If a woman has starch masks on her body, does that mean she has been pregnant before? Period, question mark. I circle is normal, but yet I still don't get pregnant. What can I use? Period, question mark. Has anybody got pregnant by just pre-cum while using birth control? Did most you women feel pregnant before find out? I am pregnant last 5 weeks, so can I start sex?
This
Dangerous.
is fucking awesome.
Transient sex. Will it hurt baby top of his head? Me and my boyfriend are trying to get pregnant and haven't took my birth control in 12 days. 38 plus 2 weeks. Pregnant? I think my dog is pregnant. Can I get bringed if he had a condom on? How long can Ugo being pregnant to get an abortion? I think I'm
Oh
pregnant
my
with
God.
my 14th child. Can you burn a Luigi board?
Oh shit, that was great. that was some good shit right there.
Hi, you're on a rock, floating
Oh.
in space. Pretty cool, huh?
I
Some of it's
forgot to,
water. Fuck
stop
it.
this.
Actually, most of it's water. I can't even get from here to there without
what the hell are
buying
we
a boat. It's
Watching
sad.
now.
I'm sad.
I'm sad. Oh, that's 19 minutes. Nope, not gonna watch that.
And not before.
Oh, that was fucking great, dude. Thank you so much for sharing that. Oh, fuck me, man. The internet. I love the internet so much. And yet hate it at the same time, because those are the people that I see all day, every day. It's always a love-hate relationship. Yeah, so there's a lot of new faces out there tonight, and you have not heard this story. So the, actually, the person whom I watched die from COVID most recently, even though this is probably 7 or 8 months ago now, his literal last words when asked if he was vaccinated for COVID, literally his last words were, "That ain't no fucking vaccine." And one of the good regulars of this stream got me a mug with those words emblazoned on it. And it is awesome. Actually, I'm going to bring up our Discord. It is a fucking A+ mug, if I do say so myself. Let's see if we can find it. Where is it? Oh, this is a cake that my wife got for one of her friends. What do you call it? Baby shower. Yep, we did that. Hy-Vee made it. It's a fucking grocery store. Ah, yes. Here it is. Best mug in the world. Oh, you can't see it on this. Damn. Let's see. There we go. Oh, that's me in a big face. Best friends. That ain't no fucking vaccine. And the other side of it is this picture, which I think is also hilarious given the context. Are my windows all that tiny? No, my screens are different resolutions. I have an ultra wide monitor and then like a 1080p, and so when I drag screens between them, it fucks things up. Yeah, that was money well spent, courtesy of good gosh darn. one of the regular viewers. He's definitely a god amongst men and a gentleman and a scholar. Some random family that's not mine, exactly. It's just like some random people hanging out together. Oh man, that mug is fantastic. And everybody, regular wide isn't good enough for me? No, man. It's gotta be extra wide. It's all about the girth. Always about the girth.
When
Everything dies. There we go. Phrasing. What the fuck? There we go. I wouldn't know girth if it hit me in the face. Oh man, I've had plenty of girth hit me in the face. What are you talking about? Wait, what? Phrasing. What's wrong with my phrasing? I said it. Oh, fuck. Satisfaction guaranteed, folks. No, I should pick that up. Yeah, that mug is fantastic, man. He just, like, totally randomly got that. And everybody in my group knows that story. Like, because, of course, like, this dude says that right before I intubate him. And I was like, really, man? Okay. All right, whatever you say, bro. And then a month later, watched him, I went to take him for a trach, actually. And the second that we took him off wall oxygen, he, like, basically couldn't tolerate it at all. He had, like, blasted a hole in his lung, basically. So he had, like, a sucking chest wound. And he had to beat a wall suction. Like, he had to keep his lung to suction or it collapsed. And that's called a tension pneumothorax, for those of you who are not following what I'm dropping. But yeah, so he got like a massive tension pneumothorax and crashed, and we like resuscitated him and like went and talked with his family, and they were like, yeah, let's not do this anymore. And so we took him off the bed. 15,000 Minnesota nurses set to strike. Oh my god, that's gonna really fuck things up. Wow. Have I tried talking to the monsters rather than killing them? No, you know what? I really just sort of want their families to suffer, actually. That's why I burn them. I don't just, like, straight kill them. I like, frickin' immolate them. Make them die as slowly and terribly as possible. And in fact, I have equipment that makes them ignite their friends. Because everybody loves a good auto defay. Yeah, so 15,000 nurse strike, huh? That's pretty bad. That's gonna bring a hospital to a grinding halt. Jesus. They want a 30. Pop goes the lungs, yeah. Yeah, the residents do need to join. That would fuck things up real bad. 30% wage increase. Man. Hospitals only offered 11. That's a pittance, man. We had to give, like, for reference, we gave our anesthetists a year and a half ago, like, a 8 or 9% raise, I think. And then just a month ago? A month or two ago, gave him a 10% raise on top of that, just to keep pace. I think we're one of the better paying jobs in town now, actually, because of that. But, I mean, like, the market, the healthcare market is just batshit crazy after COVID, because everybody retired. Like, anybody who could retire was like, nah, I'm out, and left. Can they afford 30%? It is an insane amount of money, but you know what? It's cheaper than finding 15,000 new nurses. So this is the problem that hospitals don't seem to understand, which kind of blows my fucking mind, is if you don't pay people, like, we have tons of nurses, tons of them, who, I mean, I would, if I had to throw a number out, I'd say a sixth of the nurses that we have used to be full-time nurses who quit to, quote, travel and are assigned to the hospital at a higher rate now. So they're the same nurses, they're just getting paid more money to do the exact same job. And the agency gets paid too, right? An agency nurse costs the hospital like $120 an hour or something. It's an astronomical amount of money for a frontline worker. I mean, not to like take anything away from nurses. Nurses are awesome, but like, you know, you're like kind of entry-level healthcare worker, basically. I mean, for lack of a better way to put it. But yeah, I mean, that's just an insane amount of money to spend on somebody who's like the, you know, rank and file kind of worker. But that's what they're doing, because they won't just like pay people what they're worth, and so now they have to like pay these agencies to staff them with their own people. There's no nurse. No, there is a nurse union, actually, but I think they're not like universal, and I think there are a lot of places who like specifically exclude unionized nurses. I don't really know how that works. That's kind of beyond my understanding, but that's what I gather. Okay, I missed the onk over here.
When I'm ready and not before.
How am I at horror games? Oh, dude, I love horror games. I haven't played one for a really long time, but I love them. It's a great genre. Why do you ask? Imagine the increase in the cost of care with that kind of salary increase. Yeah, well, I mean, again, though, like, it's what they're paying to replace all of these people is more expensive than what they're asking for. I mean, if you increase a nurse's salary by 30%, that's probably 70 bucks an hour, maybe 60, 70 bucks an hour. But right now they're making way more than that. Or rather, I should say the hospitals are paying more than that because they're paying placement agencies a certain amount, and obviously the nurse's pay has to come out of that. So the agency gets a cut, plus they pay the nurses an inflated fee because they're 1099 workers. But, yeah, it's just penny wise, pound foolish, man. Like, you gotta pay the piper, or all these people are gonna fucking leave. That's exactly what's happening. Mortuary assistant? Yeah, no, I've never heard of that, but that sounds awesome. I wanted to play the Resident Evil, like the newest Resident Evil game. And I, like, when it first released, and I can't remember why I didn't. I think there might have been something big with Path of Exile that was going on at that point. I can't remember. Don't feel like there should be a compromise. I think that nurses have been so criminally underpaid and mistreated for so long that they are, at this point, it's just a terrible situation that's come to a head, and they need to be compensated what they're worth. Not to mention have workplace culture improve. You know, it's basically these days just the norm for nurses to be like yelled at and, you know, have their asses slapped and grabbed by patients and, you know, be mistreated and generally just shat on. And, you know, again, they're massively underpaid for the work that they do.
How could I?
So I like, to be honest, I think a 30% pay increase is perfectly reasonable. Probably about what it should be, honestly. Like, in my opinion, nurses should make low six figures. Where's the line get drawn? Yeah, well, I mean, I would argue that everybody in healthcare is way underpaid. That is a massively unpopular position if you, like, go to the mainstream, you know, opinion, but, like, we sat down and calculated out, like, what our salaries would be if they were the same as when one of my older partners joined the group, and I'd be making like $950,000 if our salaries had just increased 3% a year. And for anyone curious, I make like half that. So yeah, like all healthcare salaries have not at all kept up with like market value. It's because a lot of it's because doctors are huge pussies when it comes to business and don't know any better. How much per year do I make to the penny? I don't know. There's no way to calculate that because I profit share. Yeah, no, they don't make low six figures. Right? It sucks. Okay, to the dollar. Oh yeah, no problem. Profit share is MLM. I mean, it's not entirely incorrect, especially with the way anesthesia reimbursement is structured. Is it over 500k? Yeah, I make
I need more mana.
I actually don't remember what my W2 was last year. My base pay is 510. Usually it's usually our profit share, it's a small amount. It's usually like, well, comparatively, it's usually like 20 grand or so. Sounds like I want to pay for your med school. Dude, I'm going to be paying for my med school for another 10 years. I am deep in the hole, friend. Official orders.
Remain in the warehouse until I personally send for. In the unlikely
So many images to review. Yep, don't envy you that, friend. That's a shitty place to be. Oh my god, I'm gonna die. Yep. Ugh.
you men and women are my greatest work. How will you use your aberration chance?
Haven't done any 3D anatomy for practical. Oh no. Oh no. Have you been in the lab? I guess going to the lab right now is not a good idea.
When I'm ready, I'm not.
Yes, you did. Hey, babe. But it all goes right back to the government, though. That's the problem. In one way or another. Not advisable to pay student loans right away? Well, I mean, it just totally depends. Like, over the past few years, it wasn't because the market was so hot. And the interest rates were, like, crazy low. So yeah, I just refinanced my loans and invested in the open market, which is not working out for me super well this year because everything is taking a fat steaming dump in the economy. But, you know, it's all about the long game, right? I'm pretty confident that I can make over 3% on aggregate over time. That's what my loans are at right now, is just under 3%, so. Yeah, if I'm not making that, something's seriously wrong. And that's why I just am not super worried about paying them off. What's my interest rate? About 3% on my loans. It's like 2.95 or something. I literally refinanced the week before the Fed started raising interest rates, just coincidentally. Felt like a golden god for doing that. That was badass. Probably saved myself like $30,000 by doing that. Hey, you can turn it into a financial audit. I got nothing to hide. That's like, honestly, like one of my biggest like sabers to rattle is how bad medical education sources are at teaching people their worth. Like they don't help you get employed. They don't tell you like what to expect as a salary. You know, and I don't care. Like I'll tell you whatever you need to know. Obviously. Your car's, yeah, my car's 6% too. But whatever. They only teach you about your self-worth, kind of. Yeah, they teach you that with a mandatory trust fall session during your day off, because that's helpful, right? Hey guys, instead of having your weekend, we're gonna have a team building exercise. Isn't that great? You guys will feel so much better. Your wellness will improve. How much did I make right after residency? So a lot of procedural. The answer is 300,000 my first year. A lot of procedural specialties have what's like they call it a buy-in, and it's complete bullshit for anesthesia, because the idea is that when you're surgical, you have to build a clientele, right? You got to build a patient base, and so you're not as valuable to the group. So you're basically at a reduced salary because you're not bringing in as much money. But with anesthesia, you're fully functional, and in fact, I was literally like doing my normal job the day after I graduated residency, and I took call my second day on the job. So like there's no step off, you know, or step up to efficacy or throughput in anesthesia, because you can just kind of like do whatever cases are put in front of you, and yet the culture is still that there's a buy-in to be part of a group. So I had 2.5 years to partner, so I took 2.5 years to step up to a partner salary, which is actually pretty short. Usually it's like 3 years. So I think I'm fairly compensated. No, I think I'm underpaid, to be honest, for the area, and we're working on that. Given the volume of work we do and commensurate salaries in the area, we're pretty substantially underpaid. Probably about 10% underpaid, honestly. But that is in the works. Getting secondhand excitement about team building trust falls. Oh, it's great. Let me tell you, there's nothing you want to do more after an 80-hour week than use your day off to go and hang out with your administrators. You know a way I can make more money on the side? I've tried, man. Like I said, I own an IV business, but that shut down with the pandemic, basically. You know, for kind of obvious reasons. It still exists, and we could resurrect it, but it's a lot of work. And we actually, like, we were at a point where it was so busy. Like, we tried to do it just like my wife and I, but we needed employees. We had to grow because we were too busy, and it was just way too much work. And so instead of doing that, we were just like, man, I don't know that we want to like grow this into an empire. And so we just stopped. Because it was going to be a full-time job for her specifically, because I have a full-time job. I didn't have that bandwidth. And she was like, yeah, I don't think I can handle this. And I was like, cool. We done then. No biggie. Start IVs for free. Well, we paid very well, like, because we had, you know, we'd have, like, nurses go with us to events and stuff. We were paying them, like, you know, $50 an hour for when they showed up. Because it was just, like, one-off jobs. It wasn't, you know, like an actual job. Only feet? Oh, dude, I should totally do that. My wife has kind of like jokingly said that she should like sell people her like, you know, panties now because she's pregnant. I was like, dude, 100% do that. That sounds amazing. Wait, you start learning more shit after like the day of your exams? That sucks. First ever medical OnlyFans. Oh, dude, you would have such a huge crowd for that. Oh my god. Kirchman says we'll be first in line for the panties. Nice. I love it. I think you're right, by the way. You want to do lip filler and IVs? You should. Yeah, you totally should. IVs are shooting fish in a barrel, man. It's so easy. And nobody does them right. Nobody does it well. Like, there are probably, I don't know, maybe 10-ish IV providers in Kansas City. I would say only one of them, other than us, actually provides a decent, like a reasonable, good service. And even then, they're not, I wouldn't, like, waste the money on them. What IVs? Like, IVs for hangovers, predominantly. Or, like, recuperation from, like, physical, you know, exertion and stuff. Like, we did a bunch of, like, marathons. Like, we had booths at mud runs and marathons and stuff like that. It's all the people that come and get fluids afterwards. Oh, what's IVs? I mean, like, fluids. Like, intravenous fluids. Sorry, I think I misunderstood your question. Do I show up to those events? Oh, no, you have to, like, you have to talk to the event coordinator and, like, buy space. It's usually not super expensive, but there are, like, packages you can buy where that, like, come with other advertisements and things like that. Usually a couple $100.
When I'm ready.
Which, when you're selling a product so expensive, that's really not that much. You know, because you basically just have to get, like, 4 people come by, and there's your cost of attendance right there. Intrapenis. Hilarious. Have I thought about buying people's blood? Well, I am a vampire. However, I think that might be complicated. Why the fuck would you run after her panties? That's a good question.
I need more mana.
Jesus. Y'all are on fire tonight. I love it. Oh, I just realized I didn't actually go get the waypoint in Solaris Temple. Shit. Oh well. Speaking of fire, uh-oh. What happened? Fire department sunk a fire engine? How do you sink a fire engine? That's crazy. Some people would pay good money for clean urine. Dude, Amaranth sold jars of bathwater for like a couple $100, I think. That girl has like, she is the monetization queen. She is nuts. Yeah, I greatly admire Amaranth, believe it or not, for her, like, business acumen. She's done some ridiculous shit that's just unbelievable. I mean, yeah, she's basically a porn star, but damn. She has leveraged that hard. Alright, what do we got here? Labeled as hers, nobody could tell the difference? Yeah, I mean, like, really? That's true. It's just funky ass bathwater, right? At the end of the day. Capacitor, what does that do? Reduced effective shock, unaffected by shock ground. Okay. Not useful to me at all. That's great. I'll sniff it out. Oh, it's gross. It's so gross. Well, gentlemen, I think I should probably go to bed, even though I don't really have to go to work tomorrow, which is great. But thank you all for joining. Hey, don't forget to join the Discord if you haven't already. For those of you who are new, thank you very much for coming out. I will be back Wednesday night, 8 p.m. Central, as always. I really appreciate you guys coming out. I hope you guys had a good time. I did, for sure. And that pregnant video is just fucking classic. Oh, man. Well, you guys have a great week. Take it easy. I am Milkman Al. I'm out.